Welcome to Breakfast with Spaniels with Dr. Judy Morgan.
Patty Steely came up first today. Maybe she got noticed. Oh, notification, yay! Yeah, it's helpful when Facebook does what it's supposed to. Morning, Carol Shim. How's Florida? Is it hot?
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
Well, it's nice to see our numbers are up a little bit, which means Facebook is notifying people. That's always a good thing, especially early on Monday morning. So, it's hot. Summer is here. Very humid in Southwest Florida. Yeah, hot and humid here too. I go out to the barn and within an hour I'm drenched. It's just is what it is. But I love the hot weather, so I'm not going to complain one bit. Except for the flies. Man, the flies are just crazy. We bought these fly traps that are working kind of not so well. Anyway, Australia. Good evening. Yes, it is evening over there. Hi, Claudia. All right. So I saw a post on Facebook one day last week where somebody said that their dog was kind of doing the slow head shake and kind of the slow scratch, but not really much of anything. And wondered, should she take him into the vet to have him looked at? And she said that, there was really no discharge. The ear wasn't red. When she looked at it, it kind of looked like no big deal, but she noticed that he was just kind of doing this a little bit. And so, of course, everyone was happy to chime in with their answers as to what it could be. And it was a little distressing to me because it distresses me in general that a lot of people, and Rodney Habib and Karen Becker posted a study that was done to find out where people get medical advice for their animals. And it's something like 80% of people get their medical advice on social media. Probably not the best place to be getting all of your medical advice, especially when you're getting it from people who, in general, may not have a clue. So I'm going to put a caveat out there that you really need to have a good relationship with your veterinarian. And, if your animal's bleeding from somewhere, he vomits more than a couple of times, you've got vomiting and diarrhea that are going on for more than 24 hours, it's a young puppy or a young kitten with vomiting and diarrhea, don't get on Facebook and ask questions. Go get an appointment with a veterinarian or go to the emergency service and have them seen. They can dehydrate very quickly, particularly this time of year. It's a little frustrating to me. I'll see these posts that are a couple of days old, and there's been 175 answers, and the animal still hasn't seen a veterinarian, and I'm like, oh my gosh, I would have, run that animal in the first 5 minutes because things were so bad. So, if they've got trouble breathing, facial swelling, seizures, don't ask questions online, get them seen. So I want to talk about what different kinds of things we can have in the ears. In this particular case, it was not an emergency. The dog was doing kind of a slow, like there's something bothering me, and kind of the non-scratch. And when she looked in the ear, it looked perfectly fine. Now, here's the thing with the ear canal. It goes down, and then it makes a right-hand turn. Think about the plumbing under your sink. Goes down, makes that little U-turn. So the ear canal goes down, and then it turns in. When you lift up the flap and look in, you see this part. There's no way to see this part. You can't get to it unless you have an otoscope. So sometimes, and this is one of my complaints about veterinary exams, a lot of veterinarians never pick up an otoscope. And if you just pick up the ear flap and take a peek down in there, you're going to miss 50% of the pathology that's going on in that ear because you're not seeing this part. That's 50% of the ear canal. So what they need to be doing is stretching the ear flap up, get their scope in there, and then kind of bend around the corner so that they can actually see all the way to the eardrum and they can see what's laying in this canal. We had a golden retriever once that just kept shaking his head, and couldn't see anything in the ear canal at all. So, the owner had waited to bring the dog in because she's like, well, the ear looks perfectly fine. When I got a scope down and looked around the corner, he had a mosquito in that horizontal canal. Can you say make you crazy? Imagine having a mosquito living in your ear. That poor dog was nuts. So we got it out. We flushed it out, and then he was really happy. So, you want to have a good exam, and when they look in there, if there's debris, you want them to take that debris and look at it under the microscope. You can't just look at the goo that's sitting in there and say, ooh, that's a bacterial infection, or ooh, that's a yeast infection, or whatever else. You have to actually take that goo, put it on a microscope slide, stain it, look at it under the microscope. And if you see a bunch of bacteria, and particularly if it's a chronic problem, you want to send that out for a culture. You want to know which bacteria are living in there. It's not, oh, look, there's rods and cocci. Well, that's great, because we can have a kind of an idea what class of antibiotics we might want to use based on the shape of the bacteria. This goes back to microbiology, my least favorite course. So you might have an idea. So you might get away with trying to treat it one time. But, if it comes back, you need to get a culture on that and find out what bacteria is growing there. Use the appropriate antibiotic so it's a one and done, not ongoing. We also need to see what's going on in that ear canal, because what if there's a polyp or some sort of growth down there? You are not going to solve chronic ear infections if there's something that's blocking the drainage of the ear canal. We see this a lot in kitty cats with polyps in their ears. So we've got to get in there. We've got to see what it looks like. Now, I can give you I got to fly in here and make me crazy. I can give you a general idea what you're looking at. If it's yellow or white pus coming out of that ear with a really bad smell, that's bacteria. If it's got a greenish, bluish pus with a really nasty smell, that's a Pseudomonas bacteria. That's even worse. We see a lot of that in the summer with dogs that are swimming chronically wet because Pseudomonas loves that dark, moist, hot environment. So we get big old hot spots on German Shepherds or Shepherds. Any of those close-coated breeds and golden retrievers who are in the pool all summer will get these nasty, nasty green discharge hot spots, and they have a really, really incredible odor that you won't forget once you smell it. So if you've got that yellow or white, if it looks like pus coming out of the ear, there's a really good chance it's a bacteria. If it's a kind of smells more like corn chips or Fritos, more of a brownish, liquidy, there's a good chance it's a yeast, which is an allergy, which means we need to look at the diet. We need to look at environmental allergies. We also need to look at moisture. We don't want moisture sitting down in the ear canal. It's supposed to be a fairly dry environment. This is why I don't like ear cleaners that are water-based. We're leaving water or hydrogen peroxide. Hydrogen peroxide breaks down to hydrogen and water. It's H2O2, which breaks down to H2O and hydrogen. That's what bubbles off. That's the hydrogen bubbling off. And what you're leaving is water in the ear. So we don't want to use hydrogen peroxide to clean ears. We don't want to use a water-based cleaner. I love witch hazel because it doesn't sting and it dries the ear canal, doesn't leave moisture down in there. If you use alcohol, that's nice and drying. However, if they have ulcerated ear canal and you put an alcohol-based cleaner in there, they're not going to let you touch their ears ever again. Just think about if you have a cut and you put alcohol on it, it's not any fun. So I really don't like alcohol-based cleaners. I don't like cleaners with a bunch of chemicals in them because a lot of times they'll have a reaction, the ear canal will turn bright red. Do not go down in there with Q-tips and swabs and, be digging around. The tissue that lines the ear canal is very delicate, and it is so easy to cause an ulceration and actually peel off that outer layer of skin inside the ear. You don't want to be doing that. So when you're using the cleaners, I really like, for instance, the Kin and Kind, and they now have a kitty cat one as well as the dog one. But it's got aloe, nice and soothing. It's got witch hazel, which is a drying agent. So when we flush that in, so we've got this canal that goes this way. You want to take the tip of your dropper, put it at the top of the canal, fill the canal, and then massage the outside of the, so I usually put the flap back down, and then I'm massaging under here. Under here, and you hear all that gushing around in there, because what's that doing? It's taking that fluid when you're massaging and it's pushing it down into this part of the canal and helping bring it back up. Then let your dog do this outside, or cat. Give it a, I like Zymox. Give it a good shake, because that's an enzyme base. Give it a good shake, and then take at most a cotton ball. Wipe what you can see and what you can get with your finger. We don't want to put anything smaller down in there, because what ends up happening is, ear wipes are fine. What's happening when you go down in there, you're packing stuff back down into the canal. You're not allowing it to get up out of there, plus you're ulcerating the ear canal. All right, so then somebody said that maybe this dog had ear mites. Well, if you have ear mites, you're going to know you have ear mites. First of all, they're not that common unless you have animals like puppies and kittens are more prone to them. Animals that come from shelters, animals that come from high density environments. Ear mites are pretty contagious between animals, but they're like a black, gritty stuff. Almost looks like coffee grounds. And those guys, you go to clean their ear canal and they're like, ah, they are so itchy. Ear mites itch like crazy because it's a bunch of bugs crawling around in the ear. Itch like crazy. And it's a dry coffee ground appearance. So very different from a yeast. So all the people who were saying to this person who lifted the ear flap and it looked perfectly normal, they were saying, oh, it has to be bacteria, it has to be a yeast, it has to be ear mites. Well, probably none of those, because she had a perfectly clean ear canal, but we don't know what's going on down in that horizontal canal that she couldn't see. So one of the things, particularly out west, you can get it anywhere, are fox-awns or grass-awns, which is the little grass seed thing. So look at grass that's overgrown, and those little seed things that have the little spikies on them, those can get lodged in ears. Out west, those are a huge problem. But like my mosquito that was in the horizontal canal, you can have a foreign body, any kind of foreign body. I mean, if you got little kids in the house, God knows what could be getting shoved down into ear canals and up noses and other places. So, boric acid, alcohol, gentian violet mix. Well, gentian violet is going to turn them purple. If you've got a really stubborn bacterial infection, maybe. I haven't used that in years and years. Jerry VS, I don't know that brand, so I can't tell you what I can't comment. So anyway, colloidal silver, there's a lot of people who love colloidal silver. I'm not a colloidal silver person, because depending on the purity of the colloidal silver that you're using and how it's manufactured, etc., you could actually be giving your dog a silver toxicity with some of those products, which is a heavy metal toxicity, and it doesn't clear the body. So be very, very careful on the products that you use. I don't recommend any because I don't use it. Your cat has itchy ears. Vet said they're clean, but she's constantly scratching. So first of all, have they gone down in there and looked around the corner? That's number one. And number two, if they're constantly, if the cat's constantly scratching, I'd be looking at a food allergy. When they're scratching this area of the body, particularly in kitty cats, and they're getting kind of broken out or behind and around the ears, and there's nothing going on in the ears, think food allergy. Think that we need to make a change in the diet for that animal. So, okay, yeah, Zymox is a totally different deal. It's an enzyme-based solution. They have skin products, ear products, but it changes the pH in the ear to make it less hospitable for yeast and bacteria to grow in there. So, what are the most common environmental allergies? It can be all kinds of things. So salicylic acid is aspirin, so it's just an anti-inflammatory. What was the question? Most common environmental allergies. Well, we see everything. It can be grass, it can be trees, it can be molds. we have all those different categories. So it just depends how seasonal it is. If it's more seasonal in the fall, it's more likely to be mold allergies. If it's more seasonal in the summer, it's probably going to be grasses. In the spring, it's trees because that's when we get all the pollen coming out like crazy. So there is seasonality to that. Okay, I gotta get to the farm. We got a lot to do today. The dogs are getting groomed. Yay!
Welcome.
That's a oops.
Spaniels
Well.
Dr. Judy Morgan.
Welcome again. I need to have the beginning music and the ending music. I don't have it all queued up. We have Zymox in the web store, drjudymorgan.com, and we also have the cleaners in the web store. Yeah, so the reason I'm not an apple cider vinegar fan, because again, we're leaving moisture in the ear. It's a water-based product. The reason it's working is because it's changing the pH, just like the Zymox would. So, Kin and Kind is the cleaner that we have. It's on drjudymorgan.com. You want to ask your mobile vet to bring the ear scope, the otoscope, on her next visit? She should have one in there. If she doesn't, she's not practicing good medicine. Yeah, we're looking at predators. She would looked at those. Okay,
Remember,
gotta go.
Purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com.